with Kinsley, one of our estheticians, and as we were talking about body contouring, there are some non-invasive options for that too, aren't there?
Absolutely. So we have something called CoolSculpting, which helps eliminate unwanted volume or fat cells in the body. And then we also have something called CoolTone, which is great for muscle toning, and just to give you that extra tightening that you're maybe not getting from your workouts.
Now, both of those involve usually several treatments, isn't that right?
Yes, yes. A lot of times with CoolSculpt, we're doing at least a couple of rounds to really get that area of concern down. A lot of people are doing their abdomen or their flanks. So you come in once, and then you come in about 6 weeks later just to have that second treatment. People are getting great results with it.
And occasionally I'll have someone who might come in and say, yeah, I want another treatment, maybe a package of 3.
Absolutely, absolutely. Some people do require a little bit more. I mean, if you think about it, everybody's body shape and size is different, so we can give you a customized quote at a consultation.
So that involves treatment on the trunk, but people will also benefit from use on the neck sometimes, won't they?
Absolutely. So it's hard to work out our chins, our submental area. I've personally had this treatment done here, and it helps almost contour the jawline a little bit as well. So it makes a great significant difference.
And there's really no appreciable downtime, isn't that right?
No downtime. You can literally go to the grocery store, go to the gym. It's not going to hinder your day-to-day.
Qualifies for this, it's really available to people of all ages. There's really almost no one who doesn't qualify for it. If you had metal right under the skin there, we might hold off on a treatment, but generally it's available to most everybody.
Yeah, we've seen probably as young as 21, and I think some of our more mature in their 80s. So you know, it's really a great treatment for everybody.
And it'll depend on your size. People who are much larger, we might lean them more toward a surgical option. That might be more cost effective and be able to remove more. But that would be determined at your evaluation where you come see us, right?
Absolutely, yeah.
So we've talked a little about CoolSculpt. Now, what happens when you've got that improved contour? Well, now it might be time to consider CoolTone. And what CoolTone does is it tones the muscles. Now, for people who come in and they're starting off a little bit larger, the CoolToning isn't a good option because even toned muscles aren't really going to show. But once we've got that fatty tissue off, either with CoolSculpt or even a liposuction, that's when it's time to consider CoolTone. Isn't that right?
Yeah, CoolTone is great. As Dr. Kingman said, for someone who's gotten their volume down, for someone who maybe wants to add a little step up in addition to their workouts, it's cleared for abdomen, thighs, and we're even getting great results with glutes as well. So it's really just going to step up that workout game for you.
And basically, it stimulates the muscle much more than you could do with yourself. For example, on the abdomen, you have to do hundreds of sit-ups or more, and this machine will actually do better than that. So it's the kind of thing that would save you plenty of time at the gym. You can get excellent results that are visible if you're thin enough. And then generally to keep it up, it will require some degree of maintenance. And it's pretty comfortable, isn't it?
Very comfortable. Patients actually, I think, kind of get used to it. They love it because they feel so toned and trim, but they're not having to over exhaust themselves.
It feels kind of like a massage, and then also it takes a few treatments, is a month apart or so?
Yeah, we're doing about 6 treatments initially within a couple of weeks or so, and then you want to come back in once monthly just to keep up your results with maintenance.
And again, as it's non-invasive, no downtime. You have your treatment and you head off to the grocery store or just go about your business.
talking about cool sculpting. I'm here with Dr. Kingman again. So a question that we get a lot of times with cool sculpting is, how does it work? It actually freezes the fat cell. So that lipid within the fat cell becomes frozen for a certain amount of time, and then we pull off the applicator and do a quick 2-minute massage. This is actually proven to give you 70% better results. So we're getting rid of those fat cells, they're being dissolved, and then you're gonna get your final result in about 3 months or so. So very non-invasive, a very tolerable procedure. It's really cool.
It turns out fat is very sensitive to cold. So we apply this handpiece to your skin, and it has a way of putting cold deeper into the tissues, but not so cold that it hurts the skin. And you feel a little cool during the treatment, but not so cold that it's painful or anything like that. And then over time, once it's exposed to that, eventually the fat cells just kind of shrink up and your body absorbs them. And that's why it takes really a few months to get the final result.
Yeah, so after about 3 months, we have you come in and do your after photos. It's really fun to see because everybody's getting a great result.